Doctors of Reddit, what's the most interesting sex-related injury you've seen? I have a simple one. During training, one of my attending's patients had such mind-shattering sex that she temporarily went blind. She had what we call valsalva retinopathy. Basically, during her orgasm, her abdominal pressure went so high that it caused multiple hemorrhages inside her retina in both eyes, causing her vision to significantly decrease to where she could only count fingers. We watched her for a bit, and it resolved/cleared on its own without further intervention. I can imagine her telling this story for years to come, and for her partner to forever say that he //ked a woman so hard that she went blind. Edit. I'm an ophthalmologist and was in residency during that time. Well, I bet she didn't see that one coming. Take your upvote and leave. A nurse friend of mine told me of a local mentally disturbed man, circa late 1990s, in our city that wasn't responding to medication, and they'd put out police checks for his well-being because he wasn't reporting to the hospital regularly for treatments. He was tormented by self-perceived religious assumptions, and when he would masturbate, he was convinced that either he was ejaculating saints, or demons in particular. From what I can remember, he went missing for approximately 2 to 3 weeks, and then came into the hospital. He had tied fishing line around his scrotum and penis, as to prevent the spreading of demons into the world. He was suffering from blood poisoning at this point. His penis and testicles had basically gone black and fallen off, and he died in hospital, I believe, within 48 hours. Very sad. I'll always remember this as a bizarre example of how tormented some people must be in this world. This is actually quite sad. I couldn't even begin to understand what was in his mind to make him do such a horrible and dangerous thing. It's also sad that he didn't have any mental help. I've never heard of something like this though, and it sounds absolutely horrifying. Former dental assistant. One of the hygienists I worked with told me this story from when she was younger and fresh out of school. Part of what a good hygienist does is alert the dentist to any unusual findings or anything that might have been overlooked. She had a young woman in her chair while cleaning her teeth. The hygienist noticed a marking at the back of her oral cavity that looked like it could have possibly be unhealthy tissue. So she grabs the dentist to take a look. Well, turns out it was a bruise from deep throating. The dentist did not shame the patient or alerted her that he knew what it was. Just told her it was normal tissue. He did lecture my hygienist privately though, so she could recognize this on the future and not alert him the next time. Oof. A guy burnt his junk really badly trying to straighten his pubes with a hair straightener. Manscaping is important, but it's better to just give your junk the ol' high and tight than give it a Bieber look. Why? Why would you do this? The mental image is so terrible. Exotic. Special ordered venomous spider up the ass. Guy called an ambulance because he wasn't sure if he could put butt bite cream up there too, as the packaging said for external use only. Lost entire transverse section of necrotic bowel. Lift, but poops in a bag now. Strangest Spider-Man origin story ever. Spider, but he can do whatever a spider can. Shits a wet any size blah 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 cap. I do not recommend to look up the medical study about the 29 or so vacuum-inflicted penis injuries. That totally didn't hurt to look at, even if I'm a woman. Edit. My favorite part of that story is the one teenage son who did it ended up in the almost immediately followed by the dad in because he didn't believe his son that it could happen at nursing school one day when nobody in class really had motivation to do anything. We spent a section of class just reading that study, lol. EMT here. We transported a man who claimed that he was having trouble breathing. Later we found out that the real reason was that an entire rolling pin had been shoved up his rectum. I'm sorry, what? I don't know why, but I always love seeing this typed out. Medical records tech. Not a doctor. Guy came in who likes to put balloons in his rectum and inflate them for sexual pleasure. Did this to the point of rupture and had to have emergency abdominal surgery. 2 or 3 years later, guess what? Comes in again for the same damn thing. Has surgery again. That must feel really nice for that dude to be like 10/10ths would do it again. You can get inflatable plugs and prostate stimulators that do this rather more safely. Can confirm. Pretty damn good. Not a doctor, but a med student friend of mine showed me literal photos of the light bulb he witnessed being pulled out of some guy's ass in an op he assisted in. The light bulb was intact. Wasn't that an episode of Scrubs? Either he has a light bulb up his butt or his colon has a brilliant idea. I've told this story a few times and it's not exactly sex related for this patient, but the condition can sometimes be a complication of erectile dysfunction medications. Back when I was in medical school, this one guy walked into the ER with a priapism. For those who don't know, a priapism is an erection that cannot subside on its own for several hours. It can be due to damage to the spinal cord, sickle cell anemia, cocaine, Viagra, etc. They need to be treated right away so as not to become necrotic from lack of oxygen. This guy had no risk factors, but for some reason just starting getting them. He had 3 in the past 4 weeks. So when he walked in he already knew the drill. The doc I was working with at the time had only ever treated one before. But he thought it would be good practice for me to treat this patient. I'll never forget the look in that guy's eyes as I held his erect penis in one hand and then immediately stuck a needle in it. Holy duck. You just made my package retreat back to the motherland. So do you actually have to drain the blood out? Or just counting on the pain making the erection go away? You have to aspirate out the blood, because the erection prevents most of it from going back into circulation and getting reoxygenated. If left like that for long enough, the penis can become necrotic. Surgery nurse here. Got called in one night for a RFO, retained foreign object. The anesthesiologist and I went to fetch the woman with a vibrator that had been sucked up into her rectum from the ER to bring her to surgery. Now I've done cases like this before, but what made this one extra special is that when we got her out of the noisy ER into the quiet elevator, we could hear it still buzzing. Awkward. We made loud conversation to try and cover it up. And this also brings up a great lesson I tell everyone when it comes to ass play. Without a base, without a trace, apostrophe. She was too anal retentive. My aunt was a nurse. She said they had a guy come in with a flashlight up his ass. Great. Get him in position to remove it, and discovered that the doctor didn't need a light. The moment he spread the guy's anus, it was as bright as day. The doctor laughed later, saying he could have read by ass light. She also had a woman with dog hair up her ass. She refused to talk to anyone, so they never did figure how she did it. For those who don't know, dogs don't have hair on their dicks. Closed bracket. I do have a question. Surely the dog hair, like that's not like a bottle or a jar or anything solid / immovable shape or unbreakable, so why / how did that cause an ER trip? Apparently it was embedded in the tissue and had to be removed. I've tried to figure it out for years, but still have no idea how anyone could accomplish this piece of stupidity. Not really sex related, but I had a guy come in who had performed his own adult circumcision at home without anesthesia. He had literally flayed his penis from the head to the balls. He told me that he did it because his shitty girlfriend gave him a hard time about being uncut. He should have gotten rid of his girlfriend and not his foreskin. Agreed. Medicine nurse here. Best and worst I've ever encountered was a 20-something-year-old female who was admitted to my unit with a massive UT from having sex with her boyfriend via her urethra. Literally pee and urethra sex. They had no idea it was supposed to go anywhere different. It still makes me cringe internally when I think about it, and it's been years edit. Yes, it's possible apparently, and they just had no idea it was supposed to go anywhere differently. They were both inexperienced, and we ended up having our social worker connect them with a sexual health nurse in the community, who was going to counsel them on the correct way to have sex. I cannot imagine the pain she went through. How the duck is that even possible? Look it up on Pornhub. It's possible. I'm a physical assistant. I worked overnights for nearly a decade. One time an elderly gentleman came in for hematuria, blood in the urine. Pretty late at night. Pretty standard complaint. There are a lot of thoughts that go through your head before even talking to the patient. Is it bleeding from the bladder? Are they on a blood thinner? Can they pee? Do you see clots? Urinary tract infection? Kidney stone? Recent surgery? I can go on. I walk in the room and introduce myself. The nurse is in the room and he says loudly to the nurse, "Can you leave?" The nurse left kinda annoyed because he was quite curt. I asked him what's going on. He proceeds to tell me that his wife will not have sex with him anymore. That she is just not interested. So lately has been applying a vacuum cleaner to his testicles. So in gather myself. Explain that I'm doubtful it is related, but go there with my interrogation. I put in my orders for labs, urine, ultrasound of his scrotum, and decide I gotta present this to the emergency department. Ed, document. This Dr. Wood was the ultimate multitasker. He would write his notes and never look at me when I presented. No matter what. I don't think it was a lack of respect thing. Because he would always talk about baseball and other things and make good eye contact. But when I was presenting a case, if he was busy it was always a raha. Yeah. Okay. I presented the case and he slowly turned his head to me with a what. The secretary was nosy to any rolled her chair half to say what was that. Of course I had to retell the story. No input from the Ed document. Ultimately the patient was diagnosed with a UT. I had to call a urologist just to ensure good follow up. The urologist was laughing the whole time. Not at that the patient, mind you. Just the story. This urologist is a very sweet man. BTW. Sometimes you just gotta take a Dyson to your balls. I preferred angling mine in the Dyson hand dryers. Shoved beans up butthole. Classic. Not exactly an injury, but a story from my wife, who works on teeth. She had a sweet little grandma walk into her clinic and ask about getting her teeth slightly filed down to give better head to her younger boyfriend. Unfortunately they couldn't, but apparently this is a pretty common question for patients to ask. God, that's a weird request. Next time I see my doctor I'll have to ask if he can give me a new sex hole. Obligatory, not a doctor, but I broke 2 ribs falling off of the bed after a hardcore doggy style session with my wife. Had a major head rush after nutting and fell over landing on the corner of the beside table. Worth it? HMM, one of the best orgasms I've ever had, immediately followed by excruciating pain which took about 2 months to heal properly. 5/10 won't do again. 1. The time I learned what colostitute meant. 2. My BFF in residency, a super nice girl next door type, got all the object in rectum cases. She was like a magnet. The biggest one was a lotion bottle, pump side towards the outside. That might be genius. The patient was a walking lotion dispenser for your convenience. I'm a nurse practitioner, but the one that comes to mind is most serious. Mid-40s couple trying to spice things up. Husband puts on a metal cock ring. Couldn't get it off and now he is super engorged. 3 hours. Emergency surgery. Possible impotence for life. /view 200D edited clock to cock. I was kind of hoping it was only a clock. I was an intern back then. Family comes with a kid who was constipated. Hasn't pooped in 3 days and now also has abdominal distension. So we are thinking intestinal obstruction due to volvulus and so on. The consultant is just there standing and smirking while we are DDXing. He asks me to take the history. So I ask the fam what's been happening for the last few days and they say the kid had diarrhea 5 days ago and he wouldn't stop shitting, so yeah, I shit you not. They inserted a soft boiled potato up his anus to stop the poop. Yeah. Why do humans do these things to other humans? One of the most common things I see patients for is diarrhea, and never once has a client tried to stick something in their dogs, but to stop it. What can I say? We were all surprised. I can name a few. Once when I was a med student I had to insert a Farley catheter to a 40-something guy. When I was preparing to jam that catheter in I felt something weird on his dick. Turns out there were 4 metallic balls about the size of a pea underneath the skin of the shaft. And of course I asked how he got it in there, and he told me they usually sharpen the blunt end of a toothbrush and jam hose duckers inside. Ducking gnarly. I also came across the old canister in the ass thing. I think the most interesting one was a glass Coke bottle with the bottom side up. Guy was married. Good times. Deployed overseas and had to treat an Iraqi who had chlamydia of his colostomy hole. He was allowing men to pay him to duck his colostomy hole. Very cute nurse here. I have heard of this more than I ever thought I would. Cute huh? Hey, do you happen to have a colostomy hole? Asking for a friend. Not the weirdest, but it's baffling how many people insert bottles into the many holes where it's possible. Head first there is a lot of suction, so they can only push it in and don't get it out. But if it's in your butt, won't a fart take care of things? Hey, thanks for watching, and don't forget to subscribe.